Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, how are you feeling today? Can you tell me your name and age, please?
Hi, I'm doing all right. My name is Sarah and I'm 50 years old.
Great, Sarah. What brings you to the hospital today?
I've noticed a persistent, scaly patch of skin on my scalp that hasn't gone away, and it's been growing slowly over the past few months. It's also started to itch and bleed a little.
I see. Have you had any medical issues in the past that you're aware of?
Yes, I was diagnosed with skin cancer a few years ago and had it removed.
Thank you for letting me know. Any family history of cancer?
Yes, my mother and maternal grandfather both had skin cancer.
I see. And do you have any allergies that you know of?
No, I don't have any known allergies.
Okay, I'll do a physical examination now and take some vital signs. Your blood pressure is 120/80 millimeters of mercury, heart rate is 72 beats per minute, and oxygen saturation is 98%.
All right.
Based on your symptoms and examination, I suspect that you have squamous cell carcinoma. We will need to do a biopsy to confirm the diagnosis, and imaging tests to see if the cancer has spread.
Okay.
If it is confirmed to be squamous cell carcinoma, we will need to discuss treatment options. This may include surgery to remove the cancerous tissue, radiation therapy, and or chemotherapy. I will also refer you to a specialist who will provide you with more information and help determine the best course of treatment.
Thank you, doctor. What about nursing management and medications?
We will need to monitor your symptoms and overall health, and manage any pain or discomfort that you may experience. Depending on the treatment plan, you may need medications such as pain relievers or antibiotics. We will also work with you on a discharge plan that ensures you receive the necessary follow-up care and support. Absolutely, Sarah. I want to make sure that we cover all the important information regarding your diagnosis and treatment options. It's important to note that squamous cell carcinoma is a type of skin cancer that develops in the squamous cells that make up the outer layer of the skin. While it can occur anywhere on the body, it is more common on areas that are frequently exposed to the sun, such as the scalp, face, ears, and neck. As we mentioned earlier, we will need to confirm the diagnosis with a biopsy, which involves removing a small sample of tissue from the affected area and sending it to a laboratory for analysis. Depending on the results, we will determine the appropriate treatment plan. Surgery is a common treatment option for squamous cell carcinoma. This involves removing the cancerous tissue along with a margin of healthy tissue to ensure that all the cancer cells have been removed. In some cases, reconstructive surgery may be necessary to repair the affected area. Radiation therapy and chemotherapy may also be used, either alone or in combination with surgery, depending on the size, location, and extent of the cancer. Throughout your treatment, we will closely monitor your symptoms and overall health, and provide medications and other support as needed. It's important to note that while squamous cell carcinoma can be serious, it is often curable if caught early and treated promptly. After your treatment is complete, We will work with you on a discharge plan that ensures you receive the necessary follow-up care and support. This may include regular checkups, imaging tests, and other measures to monitor your health and ensure that the cancer does not return. I also want to make sure that you have all the information and resources you need to manage your condition and stay informed throughout your treatment. Our team of healthcare professionals is here to support you every step of the way, and we encourage you to ask any questions or express any concerns you may have at any time.
Thank you for explaining all of that, Doctor. It's a lot to take in, but I appreciate the thoroughness of your approach.
You're welcome, Sarah. I understand that this can be a challenging time, but I want you to know that we are here for you and committed to providing the best possible care. Please don't hesitate to reach out if you need anything or have any further questions or concerns.
Now, look at the notes for Extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. May I have your name and age, please?
Good morning. My name is Sarah and I am 45 years old.
What brings you in today, Sarah?
I have been experiencing pain and swelling in my legs, and I also have some visible veins that appear to be bulging and twisted.
Have you ever had any similar symptoms before?
No, this is the first time I've experienced this.
Do you have any medical conditions or history that you would like to share with me?
Yes, I have a history of high blood pressure and I also had a blood clot in my leg a few years ago.
Thank you for letting me know. Any history of medical conditions in your family?
My mother has diabetes and my father had heart disease.
Okay. Have you ever had any allergies to medications or any other substances?
No, I have not.
Thank you. Can you describe the symptoms you've been experiencing in your legs and how long they've been going on?
The pain and swelling started a few weeks ago and have been getting worse over time. The veins in my legs have also become more noticeable and sometimes feel tender or achy.
I see. I will need to do a physical examination and check your vital signs, specifically your blood pressure, pulse rate, and oxygen saturation. After that, I will be able to give you a more detailed assessment and diagnosis. Your blood pressure is 130 over 80 millimeters of mercury, your pulse rate is 85 beats per minute, and your oxygen saturation is 98%. Based on my examination, you have varicose veins, which are caused by weakened valves in your veins that allow blood to pool and form enlarged, twisted veins. I recommend further investigations, such as an ultrasound, to assess the extent of the vein damage. In terms of nursing management, it's important to elevate your legs when possible and wear compression stockings to improve blood flow. Medications such as aspirin or other blood thinners may also be prescribed to reduce the risk of blood clots. We can discuss these in more detail after the ultrasound results are in. Finally, we'll make a discharge plan based on your treatment needs and any follow-up appointments necessary.
Thank you, Doctor. I appreciate your help and advice.
You're welcome, Sarah. Let's schedule a follow-up appointment for after your ultrasound results are in, so we can discuss the best course of action for managing your varicose veins.
Sure, that sounds good. Can you tell me more about varicose veins and what causes them?
Varicose veins are enlarged, twisted veins that can occur in any part of the body but are most commonly found in the legs. They are caused by weakened or damaged valves in the veins, which allow blood to flow backward and pool in the veins, leading to swelling and bulging. This condition is more common in women than in men and can be aggravated by obesity, pregnancy, and standing or sitting for prolonged periods.
That makes sense. Is there anything else that can be done to manage my varicose veins besides compression stockings and medication?
Yes, there are a few other treatment options available, depending on the severity of your varicose veins. One of the most common treatments is called sclerotherapy, which involves injecting a solution directly into the affected vein to cause it to shrink and eventually disappear. Another treatment option is laser therapy, which uses heat to destroy the damaged vein. In more severe cases, surgery may be necessary to remove the affected vein.
That's good to know. Is there anything I can do to prevent my varicose veins from getting worse?
Yes, there are a few things you can do to help prevent further damage to your veins. It's important to maintain a healthy weight, exercise regularly, and avoid sitting or standing for long periods of time. Wearing compression stockings can also help improve blood flow and reduce swelling. Additionally, elevating your legs whenever possible and avoiding tight clothing can help improve circulation and reduce the risk of varicose veins.
Thank you, Doctor. This has been really helpful. When should I expect to hear back about my ultrasound results?
The ultrasound results usually take a few days to come back, but I will call you as soon as I receive them to discuss the next steps for your treatment. In the meantime, if you experience any new or worsening symptoms, please do not hesitate to contact me.
I will. Thank you again, Doctor.
You're welcome, Sarah. Take care and I will see you soon for your follow-up appointment.